Hi guys, and welcome back to the channel. So in this video I want to explore a concept that I think is absolutely mandatory for everyone living with cancer to, one, be aware of, and two, to implement into their survivorship framework, and that's the profound impact of something called GMI, or guided mental imagery. Okay, and I want to talk about the evidence around why it's so profound. I want to look at some staggering research, how it can potentially link imagery practice to prolonged survival times, particularly in those with medically incurable cancers. And I want to signpost to some resources around, to allow you to actually embed these practices into your own life. Okay, so when we think about cancer survivorship, I think most people's response initially is things like dietary changes, exercise, meditation, herbal medicines, all of these kinds of things. That's valid. It's absolutely the right thing to do. They're all clinically indicated. They have very strong evidence behind them. But I think the growing field of mind-body medicine is something that's often overlooked by a lot of people with cancer. Okay, it's often demoted quite low down into the hierarchy of importance, and I think that's an issue. Okay, because actually, if we look at the research, if we look at the evidence, what that shows is that our mindset, the power of the mind, perhaps affords us one of the most powerful mechanisms we have in regards to optimizing our survivorship in the context of quality of life, but also quantity of life. And in that capacity, imagery, visualization reigns supreme. Okay, it's been a passion and an interest of mine for decades, specifically in the context of cancer. I have seen it transform the lives of thousands of people with cancer over the years. And I think commonsensically, we can all see the power of visualization imagery. Okay, just a simple example like a scary film or a thriller on the TV. Okay, imagine you're watching something that's scary, that's that has real suspense to it, and you're on your own watching it in the dark at night time. It's windy outside. What happens when we're watching those images on the screen? We feel scared. We almost can't look. We look away. We feel anxious. We feel tense around what's coming up, the threat of danger or violence or death. Okay. Our rational brain knows that that's a film or a TV show. We know they're actors. We know there's a director behind the camera. We know there's a coffee machine there for the actors. We know it's pretend. We know it's not real. But the brain doesn't care. Okay, what the brain perceives, it believes. So because it's accurate, because the images we're seeing are accurate, it makes the brain go into a fight or flight response. So we feel these emotions. We know it's not real, but we experience a physiological response. Visualization, guided mental imagery is the same. It's about creating really powerful, accurate images in our mind that tricks the brain into inducing a corresponding physiological response in the same way watching a scary movie does. Okay, and we now know from over 30 years of clinical research that can induce highly significant changes in lots of cancer suppressing mechanisms, particularly in the context of immune status, immune counts, immune activity in the tumor microenvironment, and lots of other mechanisms as well. But there was one game-changing pioneer called Dr. Carl Simonon, who took guided mental imagery from being an outlier, poorly understood treatment therapy practice very much into the mainstream. Okay, and he wrote and published a book called Getting Well Again. Okay, it was an international bestseller. It's over 30 years old now, but I still think it's mandatory reading for everyone living with cancer. And in that, he talks about a study he conducted, which looked at a large cohort of people with medically incurable cancer. Okay, these people were assessed by a panel of independent oncologists, and none of them were predicted to live more than 12 to 16 months. Okay, most of them weren't having conventional treatment because the side effects were going to outweigh any benefits. They were then taken on board by Dr. Carl Simonon at his cancer center. And they were treated using his methods, his practices. Dr. Simonon was a radio oncologist, okay? And he treated them using the Simonon method. a big part of which was extensive, incredibly intensive guided mental imagery. Okay, and these are the statistics. Okay, so of these medically incurable patients, 22.2% had no signs of disease at the end of the study and had made a full recovery. These are medically incurable cases. Okay, 22.2% had no signs of disease, had made a full recovery. 19.1% had experienced a clinically significant reduction, okay, in their cancer status. 27.1 had experienced stable disease with no growth, and 31.8% had experienced disease progression. Okay, so across that cohort, what that essentially means is that over 2/3 of these individuals, okay, with medically incurable cancer who couldn't realistically be expected to survive more than 16 months, 2/3 of them had either recovered, had experienced disease regression, or had stabilized. Okay, and that, that is profound research, and that's by no means to say that guided mental imagery can cure cancer. Okay, that's not the conclusion we can come to. Okay, the conclusion we can come to is that when we're using guided mental imagery as part of our overarching survivorship framework, using the best of conventional medicine, dietary changes, herbal medicines, meditation, exercise, good quality sleep, all of these kinds of things, when we integrate guided imagery into that, our capacity to become exceptional, to experience these kinds of, improvements in quality and quantity of life are unleashed in truly unique ways. And it's for that reason that I think everyone living with cancer needs to be integrating guided mental imagery into their daily self-care. Okay. And to facilitate that, we will be releasing resources on our website. But until then, and to get you started, I cannot recommend enough you buy this book, okay, and you read it cover to cover, but particularly you use the guided mental imagery scripts, because that is what Dr. Simonon used in the data that we've just explored. Okay, so please do check that out. If you have any questions about how it relates to you, okay, any specifics, then please let me know in the comments below. As always, please do subscribe to the channel so you stay updated when these videos are released every week, and I'll see you soon.